Good morning, I'm Vicky Nguyen.
And I'm Savannah Sellers. Right now on Morning News Now, jabs or swabs? President Joe Biden is expected to announce that all federal employees must get the COVID vaccine or get tested weekly. And federal workers aren't the only ones. Some of America's largest companies, including Facebook and Google, also announcing new vaccine rules. The latest on the growing efforts to stem the spread of the dangerous Delta variant. Back on track, the massive infrastructure bill passed a key test in the Senate after more than a month of negotiations. 17 Republicans signed on with all 50 Democrats to move the $550 billion bill to debate. We'll tell you why it still faces a tough road ahead, though, as some Republican lawmakers look to stop it from passing. Tokyo triumph. Team USA is dominating the Olympic pool, winning 5 medals while also setting a new record. And right now, the women's all-around gymnastics competition is underway. This time, Simone Biles not representing the red, white, and blue. The latest on the sport's biggest title that's now up for grabs. That is just, I mean, we could keep talking about that all week.
And we will, I'm sure. And
absolutely.
For years to come, very exciting Olympics last night. A lot of that to get to. Before we get started, can I mention one thing? Mm-hmm. You have this rule on the show. It's called Animal Print Thursdays. I'm a guest. Joe will be back soon. But I just want to address the fact that that's why we both showed up today.
And we were wearing this. And I was like, wow, you're so nice that you've followed the rules. And now here we are.
Yeah, house rules.
So I love it. You're a great guest. We begin, though, with the growing push to mandate COVID vaccines in the workplace as the Delta variant rapidly spreads nationwide.
Yeah, tech giants Google and Facebook are now some of the largest employers telling workers they must be vaccinated if they want to return to the office. This comes on the heels of a major announcement expected from President Biden today. The message to all civilian federal employees: get your COVID vaccination or prepare for regular testing and masking rules. And the topic of masks still creating a lot of confusion and debate following the CDC's new guidance, especially on how it impacts vaccinated people. While some states are considering the new guidance, others are refusing another mandate.
We have a team covering everything you need to know this morning about the current rise in cases and the debate over masks and the vaccine. Let's begin with NBC News correspondent Carrie Sanders in Orlando, Florida. Carrie, good morning. So one of Orlando's biggest tourist spots, of course, Disney World. You think Orlando, a lot of times you think Disney World or Universal. Disney World is now changing its mask rules. What are they doing, and are other theme parks changing their rules as well?
Well, this is really reflective of what they have seen at the largest healthcare system here in Central Florida, AdventHealth, which is where I am. They've seen increasing numbers of people at dramatic levels of folks who are testing positive for coronavirus. So as you just noted, Disney World now has decided that they are proactively going to change their mask policy, and they gave us a statement. I'll just read it to you as we take a look at the video of Disney World here, that Disney will require cast members and guests age 2 and up to wear face coverings in all indoor locations of Walt Disney World Resort and Disneyland Resort, that's California, beginning Friday 30th, regardless of vaccine status. And of course, that's important because there has been a general sense that those that are vaccinated don't have to do this. Those that aren't vaccinated do. But the honor system does not apparently work as well as they'd hoped. Let's take a look at the statistics here that are reflective of just Orange County. And of course, Disney World is partially in Orange County. And this is what they have seen in terms of just one day number of coronavirus cases. It is 1,371 cases on just Tuesday. And to understand that, in June, they had a 3.7% positivity rate, and now it's at 15.58. It's why the Orange County mayor called for a state of emergency. He says this is indeed a crisis, Savannah.
All right, so that was in Orange County. Now let's broaden out to the whole state. Florida Governor Ron DeSantis has banned local leaders, though, from enacting a mask mandate. Some counties, as we're talking about here, are still taking action. So what's happening there in that broader sense across the state, first in Orlando, but then also just as these local leaders have to try to make decisions, given that that's the guidance coming from their governor?
Well, you know, the governor and the state legislature took away the authority of local governments to respond in their local communities with things like mask mandates. In fact, we saw in Broward County earlier this year, those who had been fined were given a pass by the governor and said, you don't have to pay those fines. And so it's left the local governments, according to, for instance, the Orange County mayor, a sense of being powerless. And so they can get out there like cheerleaders and sort of encourage people to do things like wear masks if you're indoors, but not require it. This is what the Orange County Mayor, Jerry Demings, had to say.
We want our residents, businesses, and visitors to follow the updated CDC guidelines to make sure there won't be another shutdown like we experienced last year.
And so the governor there, the Orange County mayor there, talking about the fact that he does not have the authority because it was taken away by the governor. Savannah?
So how is the governor reacting to this new CDC guidance? I mean, it's that where there is a high transmissible rate of COVID, you should be masking up. You're telling us these high case numbers. What's his response to this new CDC guidance?
Well, when you look at the numbers right there for the state of Florida, I mean, they're eye-popping. Early in this process of what has been a pandemic that we have all gone through in a roller coaster, if you compared Florida to California, and they had two very different approaches in terms of masking, the numbers were about the same. And so if there was the battle, the governor's response was one that seemed to be, to residents in Florida, to be the appropriate response, because the masking mandates were not as strict and the indoor lockdowns were nothing like California. But now you can see the battle may have been won then, but now the war, very different case when you see how the numbers have climbed, as we said, more than 15% positivity rate. The governor telling West TV, the NBC station here, in part, when you say to someone you've got to wear 6 masks after you're fully vaccinated, that is not evidence-based. There is no data to support it, but it does send a message to people who may be more hesitant to get the vaccine to say, what the heck? If it's not working, why would I get it? And so that's where we find ourselves with the vaccine drive. And so what the governor is saying is that there is confusion by forcing people to wear masks. We'll see how this plays out. But if we look at the wastewater treatment plants, which in many parts of the country, they monitor what's in the wastewater treatment plants, and they're able to see the RNA that suggests where things are going. And it's been a very accurate predictor. And the graph goes like this right now, which means in about 7 days, if everything follows as it has before, the data will predict that we will see a huge increase in the next week here in Orange County of people coming down with coronavirus. Savannah?
And Governor DeSantis, they're getting at both the confusion and also the concern. Does this make people not want to go get the shot if it means they still have to wear a mask, which we will get into with the doctor momentarily. Carrie, good to see you. Thanks for your reporting.
All right, now to President Biden's expected announcement later this morning on a vaccine requirement for federal workers. NBC News White House correspondent Monica Alba is here now. And Monica, what are you learning about the president's announcement today, and just how many employees are we talking about?
This had been in the works for a couple of weeks, Vicky. The White House was looking at this, and it will apply, we understand, to millions of federal workers. And the way the president is going to announce this in these remarks later this afternoon is to say, essentially, this is not a mandate. This is something the White House has been very careful about language-wise, because remember, just about a month or so ago, the president said the virus was in retreat, trying to declare our independence from it on the 4th of July. So this is something where the White House is saying they're not going to go back to the previous lockdowns or mandates that we saw. Instead, they're going to ask federal workers to have proof of vaccination or then be willing to submit themselves to regular testing, something we've seen a lot of states do. For instance, New York, where you guys are, that's what they're already doing for 300,000 federal employees. And that's going to start likely in September. So still giving those federal workers and, of course, state ones time to get vaccinated. And that's really the urgent message that you're going to hear from the president today.
So there is a choice here. It's get the jab or get a swab, right? So what about employees who don't want to get the vaccine? Do they have an alternative other than this frequent testing? And how often will they need to be tested?
And that's what we don't know yet. And different agencies may have different rules. So, for instance, the White House is going to make these recommendations, and they're going to say, we would like all of the department heads to essentially come back to us with their plans. But the requirement overall is one or the other, either be vaccinated or be willing to either do weekly testing or whatever they determine is best, because it is these breakthrough cases that have been such a cause for concern. As we know, guys, here just on the campus itself at the White House, they've seen examples of them, even though they've they've still declined to give us exact numbers of how many White House officials have tested positive after being fully vaccinated.
And we've talked to public health officials who say they think the number of breakthrough infections is much higher than we actually even know. So, Monica, we know the military has also been struggling to vaccinate more of its service members. The president has the power to require the military to get vaccinated, but that seems unlikely given what you're saying, that he does not want to issue a mandate. Do we know what percentage of our service members have already gotten the shot?
About 73% have gotten their first dose, Vicki, and about somewhere in the 60% range are fully vaccinated, which is higher than the national statistics. We know only about 50% of Americans are currently fully vaccinated, and the White House missed its goal of having 70% of all adults with one dose by the 4th of July. In fact, they're still not there. In terms of making this mandatory for the military, the other roadblock there is that, remember, these vaccines are still under emergency use authorization. If that were to change, then there's a possibility, but the White House will likely defer to the defense secretary and have him make that request before making it official.
Big announcement coming. Thanks for breaking it down for us, Monica.
Let's now bring in NBC News medical contributor Dr. Kavita Patel. Dr. Patel, always great to have you. So let's get into these vaccine mandates. Of course, this one that we were just discussing, we're expecting from the president. New York State just announced a similar thing, requiring state employees to either get the vaccine or undergo weekly testing. Let's talk through the impact that these mandates have sort of overall. I'm not sure if the goal here is that enough people comply based on these mandates that it really makes a dent here, or if it's to make each individual workplace safer. But what do you make of these?
Yeah, good morning, Savannah and Vicki. You're right. This is a pretty uncharted territory for adults. But keep in mind, for most healthcare workers and children, we've had a lot of vaccine requirements for decades. So here's what it means. It means that employees will have confidence in returning to the workplace. I think you're seeing that the recent CDC guidance has shaken not just consumer confidence, but it's made people wonder, is my workplace safe? Is my school safe, et cetera? This mandate or series of mandates, private and public, I think allow for people to have that sense of normalcy so that they can go mask free in workplaces. I think it'll be a real signal that we're returning to normal if we can do it.
Absolutely. So let's dig into some of the mask issue, and I'm going to ask you what we were just talking about with Carrie in a second. But first, let's start with this idea that it's a pandemic of the unvaccinated and what that's essentially doing to vaccinated people. Some are feeling anger towards the unvaccinated. I want to read this to you. One woman told NBC News, "Now I'm getting to the place where I'm angry that I see other people not doing the same, not getting vaccinated when they can. Don't we all want to get back to normal?" You just mentioned, of course, getting this shot is a way to get back to normal. It's a step in the right direction. How do you address these concerns of vaccinated people who are kind of wondering, hey, I got the shot. What was the point of that? And how do they help reach unvaccinated people?
Yeah, it's something I'm seeing personally and professionally as well, Savannah. So number one, you have to keep in mind these vaccines, and all the data supports it, are still incredibly effective at preventing what's happening in the pandemic of the unvaccinated. We're seeing the hospitals overflowing. I'm watching people stay in the ICU a lot longer, Savannah, than we would even expect, which is a bad signal about how dangerous this Delta variant is. Number two, if you are angry, think about it this way. It's actually not just for the people who, quote unquote, are anti-vaxxers. There's a large population that is incredibly heterogeneous, some of whom we've actually let down, people of color, who we really let down in this pandemic in the first place. So when you think about get the vaccine for yourself, you're protecting your neighborhood, your family, your community. But then when you're also having to wear a mask, you're doing the same for an unvaccinated child, for someone who's got a compromised condition. Those people don't have labels on them. So think about it as just one step to keep your community safe. The third is tell people, instead of being angry, find that person you know, all of us do, who refuses or is concerned about getting vaccinated. Focus not on blaming them, focus on sitting down with them and saying, you're important to me. I want you to do this for me, and making it a little more personal. I hope we can get past the anger that way.
That is great advice. Dr. Patel, quickly before I let you go, I just got to ask you on this mask topic. What's your message to people who are now maybe questioning the effectiveness of the vaccine? If they see those people who got a shot still need to wear a mask, I thought that was the point.
Yeah, that's first of all, the point really was it saves your life. It prevents you from going into the hospital. Thinking about wearing a mask just tells us that this is a pandemic that we have not gotten behind us. I have to remind people, January of 2020, Savannah, we had one man that was hospitalized in Washington state with this. And look where we are now. We can beat this back. Wearing a mask is a symbol of doing that. Think of it as your suit of armor, with your vaccine being your internal protection, your mask being your external one.
Dr. Kavita Patel, always breaking it down in the best way. Thank you so much. Good to see you.
Now to a big deal on Capitol Hill. Lawmakers are one step closer this morning to passing a $550 billion infrastructure package. After more than a month of negotiations, the Senate yesterday voted 67-32 to begin debate on the measure. That includes 17 Republicans for the bill.
The Senate has just come together and in a strong bipartisan fashion voted to begin the legislative process here on the Senate floor.
We've still got a long ways to go before we get to the finish line, but this was a vitally important first step.
NBC News Capitol Hill correspondent Leanne Caldwell joins us now. Leanne, Democrats are also trying to pass a separate party line measure for human infrastructure. What can you tell us about that so-called reconciliation bill?
Good morning, Vicki. That's right. As there's a lot of excitement about agreement on this bipartisan infrastructure bill, many Democrats are demanding movement very soon on this $3.5 trillion human infrastructure bill. And one key component in that is a major expansion of home-based health care for the elderly.
Hey, let me buckle you in, though, okay?
90-year-old Ray Newbaker struggles with dementia and a broken hip. Her children, Paula and Jay, are her round-the-clock caregivers.
Do you like your home?
Oh, yes. I love it here.
But it's not easy, taking care of her personal needs, managing her finances and doctor's visits, along with her worsening dementia. It's emotionally, physically, and financially exhausting.
Is this hard on you?
It's the hardest thing I've ever done in my entire life.
A growing number of aging Americans would prefer to stay at home. Because Medicare doesn't provide for long-term home health care, and Medicaid assists mostly low-income patients, and waivers often come with long wait lists. In their twilight years, many fall through the cracks.
I call it the twilight zone, where we make too much for Medicaid, and yet we don't make enough where we can afford 24/7 high-quality care for my mother. So we're stuck, paying for her care out of our own pocket. And while we're more than happy that we're able to do it, it's really not sustainable.
In the Democrats' human infrastructure bill, they want to increase the number of people eligible to receive home-based care through Medicaid by raising the income cap to 3 times the poverty level, or an income of about $38,000 per year. It would provide financial help to an estimated 3.2 million elderly and disabled.
Many people in this country are going to spend down their entire life savings caring for parents, caring for children. We can do better than that. We know how fundamental this is, and we have to stop relying on our safety net being the low-paid or unpaid work of women.
40 million home health care workers are some of the lowest paid in the country. Jody has been taking care of the elderly for 25 years.
There's people out there that are working at McDonald's that are making more money than me, and that's really not fair.
Have you ever thought about leaving this job because of the wage?
Absolutely.
Along with aiding the elderly, Democrats' proposal would help people like Jody, too, by requiring they're paid a living wage. The 2 parts of the proposal come with a high price tag, up to $300 billion.
And people say it's expensive, and I'd say, yep, it is expensive. It's about time we started to invest in families.
Democrats are confident that their proposal is popular. Internal polling obtained by NBC News found that likely Democratic voters are very supportive of expanding home-based elderly care and increasing wages for those workers. As for Republicans, well, Republican senators tell me that they might be open to having a conversation about expanding home-based care for the elderly, but they are adamantly opposed in including it in this major package. They call it a reckless tax and spending spree, Vicki.
Yeah, they got to find the money. It is a lot of money, but when you compare the wages of an elder care worker to that of a fast food worker, it just really puts things in perspective. Leanne, thank you so much.
Turning now to the Olympics, where Team USA continues to dominate in the swimming pool. Some emotional wins early this morning from the Aquatic Center.
Meanwhile, the women's gymnastics team has taken the floor without Simone Biles. Suni Lee and Jade Carey are looking to make a statement in today's individual competition. This means another late night for me trying to get to bed early for the show, but I gotta watch. NBC News correspondent Stephanie Gosk joins us now for a look at some of the big Olympic headlines this morning. Good morning, Steph. Let's start in the pool. All eyes on Team USA. Guys. Hey, they did not disappoint.
No, they have not.
5 medals, a new Olympic record. Steph, get us all caught up.
Yeah, listen, you're not the only one not getting sleep watching some of these events. I mean, they're all through the day here, and the swimming is so exciting. And I always make sure that I'm out of bed, I've had my breakfast, I'm ready to watch. And today was no exception. And you talk about Caleb Dressel, right? I mean, here's a guy who everyone has been watching him. They're expecting him to have a really big games. This is the marquee race, really, this 100-meter freestyle, and he wins it. He wins it. He gets an Olympic record. It's an incredible moment with his family afterwards, who he's zooming with. Really emotional. You could just really tell on his face how important it was to him. But one of the biggest surprises today was this kid, Bobby Fink, who raced in the 800 meter. It was this grueling freestyle race. And I'm watching it, and he's in 4th, and then he's in 5th, and then it's 16 lengths, right? So by length 12, he's still in 5th, and you're like, he doesn't stand a chance, and it's too bad. Suddenly, out of nowhere, the last 50 meters, this kid sprints like no one has ever seen him sprint before. Rowdy Gaines from NBC Sports, I mean, they probably had to peel the guy off the roof because of those last 50 meters, and he wins the gold. So cool. And then finally, just to mention Katie Ledecky, the anchor of the women's relay, the 200-meter freestyle relay, also having a 200-meter leg of her life, able to come in, beat the Aussies, who were the favorites, and almost get the gold in that event, but the team won the silver. Even so, it was a silver they were not supposed to get necessarily, and it was just a ton of fun to watch.
Oh, my
goodness. So fun to watch. Yeah, she made up like 2 seconds. I love how you described Bobby Fink's race. You know, I mean, at the end, just pulled that out.
Steph, you're good at this. You could be a commentator. Yeah, I love that rundown. I mean, that was amazing. Okay, now let's talk gymnastics. The women's gymnastics individual all-around is currently underway. Of course, the big headline over the last few days has been that Simone Biles is not competing today. She pulled herself out of this, as well as, of course, that team one where we first saw that happen. So what can we expect from the two who are competing here, Suni Lee and Jade Carey?
Look, the first thing to say is that Simone Biles is in the arena tonight. She showed up to cheer on her teammates, which is pretty incredible. So Suni Lee and Jade Carey, and I'll talk about Suni Lee really, first of all, because she's an incredible gymnast, and so many of these gymnasts on this team are, and really Simone Biles has taken a bit of this, or a lot of the spotlight away from them, and Suni Lee really has a chance to get the gold here, depending on her performance. You know, she is really the best in the world in uneven bars, better than Simone Biles, and has the hardest routine in the world. And, you know, watch her. If she has a good night, she very easily could come out with the gold medal. And consider this, too, after this week that they've had, that emotional has thrown them all off kilter, and they've had to react. They got the silver medal that night in the team event. I mean, they're all trying to keep it together here. It just would be so tremendous to see these two young women have a great night tonight. So all eyes on them tonight.
Oh my gosh,
so excited for them.
Break out in USA.
No, totally. You're getting us pumped here in the States. But yeah, you know, I'm so glad you mentioned that, because I do feel like the rest of the women's team has been out of the spotlight, sort of overshadowed by everything that Simone Biles is going through, and she's really documenting it in real time. So I'm glad you got that mentioned. We're going to be watching both of those women, Jade Carey and Suni Lee. And Jade has her dad there coaching, so that's pretty exciting. All right, Steph, one last thing before we let you go. I really want to talk about what's happening with COVID. We know U.S. pole vaulter Sam Kendricks, he tested positive for coronavirus. I heard this morning his dad saying he doesn't have any symptoms. He feels fine. But what's the situation there in Japan and at the Games specifically when it comes to COVID?
Yeah, listen, I mean, this is really tough. These athletes are being tested all the time. We don't know whether he's vaccinated or not, but a good proportion, majority of the U.S. athletes are. So he tests positive, and that's it. I mean, he has to go into isolation now, according to the rules. And whether he has symptoms or not, he's going to be in a hotel room just waiting until he tests negative, and it's going to take him out of the mix. It also had a moment for the Australian team in track and field. They had been spending time around him 3 of their athletes had to be tested. There were 24 new cases within the kind of Olympic bubble, but it is really important to point out that outside of that Olympic bubble, in this city right now, cases are exploding. On Wednesday, there were over 3,800 cases in the city. And just to give you some perspective on that, when I arrived here about 10 days ago, the case totals were maybe 1,500, 1,600. It is a huge increase. It is the largest wave that they've seen so far in this country. And people in this city are getting uneasy about where this is going. Guys,
and of course, they're still in a state of emergency there. We hear some sirens where you are. Go get fueled up. We know you have another long day ahead. Stephanie, thank you so much.
Thank you. Let's now get a check on your morning news now weather, which means that Bill Cairns is here. Hey, good morning.
Hey, good morning, guys. So we have severe storms to talk about, more heat, and of course, we'll get to the weekend forecast. So the first thing first, we did see those storms last night, a little bit of damage. Wisconsin, storms woke people up in Chicago in the middle of the night. Those have weakened. We do have a batch that's heading through the Great Lakes. Buffalo and Erie, watch out. Those storms are going to come through. Some very heavy rain for your morning rush hour here, and then eventually towards Rochester and Syracuse. So later on today, heads up to our friends from Washington, D.C., Baltimore, Philadelphia, up to New York City. That area of orange is an enhanced risk of severe storms. Damaging winds are possible, maybe even an isolated tornado. So 66 million people at risk of severe storms today, all the way from the mid-Atlantic, all the way through the Ohio Valley, back into Missouri. And the heat hasn't gone anywhere. It's still exceptionally hot. 52 million people under heat advisories or warnings. It's a very hot and humid air mass from Omaha to Tulsa, Little Rock. Dallas is included in this now. Nashville, all the way down to New Orleans and the Florida Panhandle. And our friends in the Pacific Northwest are back under heat advisories too. So it's hot. It's the peak of the summer heat season. This is typically when it's the hottest, and it's not disappointing. 100 today in St. Louis, 97 in New Orleans. You'll see the Northeast is cooler, but that's because of the rain and thunderstorms that's coming through this afternoon. So far as the weekend goes, the getaway day, not bad on the East Coast, but still very hot. Look at 98 in Charlotte. There'll be a little bit of wet weather in the Intermountain West, and look how hot it is in the Northwest too. 105 in Medford. Saturday, that's your day, girls. Hot temperatures will be about 80s to about upper 70s. Perfect in the Northeast on Saturday. Sunday, some late rain will come into the Northeast, scattered storms in the Southeast, and we're still happy about any rain we get in the West. I know we don't want to ruin people's weekends, but with all the fires we've had and all the hot conditions, we'll take whatever storms we get.
Yes, absolutely, especially out in the West. Bill, love the weekend forecast. Thank you.
Thanks, Bill.
Almost Friday.
All right.
See you in a bit. All right, now coming up, whistleblowers are speaking out against alleged abuse at a migrant shelter in Texas.
They say children were mistreated and staffers were told to downplay a COVID outbreak within the facility. More on those shocking allegations next.
Whistleblowers are sounding the alarm this morning, saying they were told to downplay coronavirus outbreaks among migrant children at the overcrowded Fort Bliss shelter. In a complaint filed Wednesday, 2 federal employees alleged they were told to, quote, make everything sound positive about the Fort Bliss experience and to play down anything negative. The contractors accused did not respond to NBC News' request for comment. NBC News Justice correspondent Julia Ainsley broke this story, and she joins us now. Good morning, Julia. So do we know how widespread the possible coronavirus outbreak was in migrant shelters? Tell us about what these employees are saying was going on there.
Well, the employees say it was hundreds of children. They were able to tell at least an estimate because there was a tent where COVID positive children were taken. But they say that when they asked the staff there for an estimate of how widespread the infection was among children and staff, they were told by a government employee, we can't give you that information because we're afraid you'll leak it to the media. Very explicit that was the reason why they were not giving employees who were working there every day and very overcrowded, close conditions, not giving them the answer of those case rates as they did go up. Those employees worked at this Fort Bliss, Texas facility that's near El Paso, Texas, but from April until late June. So since that time, we do believe that there have been less crowded conditions, but still there remain to be a lot of questions about why they handled this way and why they weren't able to get that information.
Yeah, and by the way, according to your reporting, when I say that they were told to make everything sound positive, downplay the negative, it wasn't just these COVID cases. I mean, it was a lice outbreak, it sounds like, among the young girls, riots in the young boys' tents. I mean, just conditions that were just simply not right. Now, how is the Department of Health and Human Services responding to these whistleblowers?
Yeah, you're right. Lots of conditions like that, including not having clean underwear. And HHS is saying that basically if there were ever allegations, they reported those through their chain of command, tried to investigate any allegations of wrongdoing, that they do have, the child welfare, the child's welfare interest at heart here. That's how they've responded to us. But, there have been other allegations about this facility. In fact, there was a lawsuit filed about how children were treated in this facility in June. And so far, HHS has not closed the facility or launched an overall investigation into how contractors have run Fort Bliss. Instead, they say they take each allegation individually. And so for people who have seen this abuse, this mistreatment of children, they want an answer. They basically have called to just close the facility in the first place.
All right, Julia Ainsley, more to hear from on this as we wait for a response. Thanks so much, as always, for your reporting. And now coming up, Texas state Democrats are still holding out to try to stop Republicans' election legislation.
Yeah, they're meeting with some high-profile Democrats in Washington, D.C. We'll tell you who they'll be seeing next. And I said, hey, it isn't such a wonderful kind of day for fans of the children's show Arthur. PBS announced after 25 seasons, the longest-running animated kids series in history is coming to an end. The show followed the life of an 8-year-old aardvark named Arthur as he learned lessons on kindness, empathy, and inclusion. The executive producer of Arthur says even though the show has come to an end, episodes will still air on PBS Kids. That final season will air in the winter of 2022. And that song's going to be stuck in my head for the rest of the day.
You know what's so funny is it's just such a staple. You hear 25 seasons. Think back to the beginning when they were pitching it, it's going to be an 8-year-old aardvark, and somehow it's worked.
It's great. And it's a show that I think all parents like because of what it teaches your kids.
Yeah. Oh, my gosh, the lessons. It's amazing. All right. Thanks, Vicki. Now, activists are marching for 4 days in the unrelenting Texas summer heat with the goal of urging the Senate to, quote, stop the attacks on democracy as the debate over voting rights legislation in the state drags on. Marchers with what's called the Poor People's Campaign are 8 miles into a 27-mile march from Georgetown, Texas, to the state's capital city of Austin. Among those participating are Reverend Dr. William Barber II and former presidential candidate Beto O'Rourke. NBC News Now correspondent Priscilla Thompson has been following these marchers. She joins us now from one of their stops at the Good Hope Baptist Church in Round Rock, Texas. Priscilla, good morning. So just remind us here, because I know you were with us yesterday, what do they hope to accomplish with this march?
Savannah, good morning. You see those marchers behind me starting to pull into the parking lot and get their drinks, their water, their snacks, and their breakfast in order to prepare for day 2 in this Texas heat marching. And the reason why they're doing this is because they want to continue to call for action on some sort of federal voting rights action and continue to put pressure not only on Congress, but also on the man at the top to do more. I want to play part of my conversation with one of those marchers. Take a listen. So you think the president needs to do more?
Absolutely. What is he doing? What is his plan to save American democracy? I haven't heard it. He tells me to stay in school and shoot for the stars. What is that? What the hell is that? It's nothing. Democracy, if democracy here fails, democracy around the world fails.
And so the activists here are saying in no uncertain terms that they want President Biden to support the end of the filibuster and for Congress to actually act on that so that they can pass the For the People Act and also fully restore the Voting Rights Act of 1965. Savannah?
So, Priscilla, there's this march going on for miles. There are big names involved. Tell me how the Poor People's Campaign is hoping to actually really make a difference here and convince the Texas state legislature to drop their latest voting rights legislation.
Yeah, so while this march is happening in Texas, and Texas is sort of being hailed as this example, the focus on change is really, they're saying that this is far beyond Texas. They're talking about the dozens of other states that are considering more restrictive voting laws or have already passed those laws. And so what they're saying is that this is beyond a state-by-state litigation situation, but that action needs to be taken at the federal level. And they're saying, just like in that Selma to Montgomery march, where the focus was in Alabama, Alabama, the call for change was one of national importance. Savannah?
All right, Priscilla Thompson, great reporting. Thanks so much.
Now to a story first on NBC News. New this morning, we are learning those Texas state Democrats breaking quorum and escaping to the nation's capital are preparing for some high-profile meetings today. They're scheduled to meet with voting rights activist Stacey Abrams, as well as Bill and Hillary Clinton. They also received an invitation to testify before the House about preserving state voting rights. NBC News senior reporter Jane Tim joins us now with more on her exclusive reporting. Jane, you broke this story. Let's talk first about your latest post on NBCnews.com just minutes ago. What do the Texas Democrats hope to get out of this meeting with the Clintons and Stacey Abrams?
You know, this seems like a real big win for them, Vicki. They have been in D.C. for weeks, and federal voting legislation is no closer to being passed. But taking a meeting with a former president, former Secretary of State Hillary Clinton, and of course, for them, voting rights superstar Stacey Abrams is on par with the former president in terms of just Democratic firepower for them. And they hope to both ask for advice on how they can better lobby. They know that the Clintons, as well as Stacey Abrams, have a lot of experience in the South. They feel some camaraderie there. And they hope to ask for advice, as well as urge them, especially the Clintons, to get more involved in this fight. I talked with one lawmaker who said he'd ask them to call up Senator Sinema and Senator Manchin, who have opposed abolishing the filibuster, to pass voting reform, and urge them to get involved and lobby on their behalf. They know that they need as much momentum and star power as possible, especially as people get a little more used to the fact these Democrats have been in Washington quite a while.
Well, Jane, what are the Clintons saying? Catch us up. What are they saying about the Texas Democrats' efforts in Washington?
They both put out really sort of applauding statements saying they were coming to good trouble. Like Congressman John Lewis used to say, they have put their clearly support behind these lawmakers with a couple of statements that we've seen. I think we have them if we want to throw them on the screen. Yeah. The fight to protect our voting rights is the fight to protect our democracy, said Hillary Clinton. We stand with them and applaud their ongoing efforts to ensure the citizens have access to the ballot box. Bill Clinton said something very, very similar as well. It is part of a much wider effort by Republicans nationwide to make it harder to cast a vote and have it counted. He's really pushing to that national narrative that we're seeing. Vicki?
Jane, you mentioned, obviously, they want to leverage some of this star power, the name recognition, of course, of the Clintons and Stacey Abrams. On the Democrat side, what are the Republicans saying? Has there been a GOP response at all?
You know, Republicans back home in Texas are not pleased. They had one defection from the Democrats last week, and they were very excited to get somebody back home, thinking they were moving in on this quorum. You need to keep a majority of members, 51 members, in D.C. to really continue breaking quorum. So they were very excited when one Democrat briefly went back to Austin, but he came back on Sunday, and the Democrats feel pretty strong, and the Republicans are signing warrants for their arrest back in Austin.
Jane Tim, thank you so much for your exclusive reporting on that.
Thanks, Vicki.
And coming up, companies are getting more and more worried about the Delta variant of COVID-19.
Yeah, now some of the nation's biggest names are requiring their employees to get the shot. We'll tell you which ones coming up next.
For the athletes competing in Tokyo, this is the moment when a lifelong dream turns into a thrilling few weeks of pressure and performance, as we've definitely seen play out.
I know. For us, even here, just as viewers.
Yeah.
It is a rare glimpse at that greatness that sports writers certainly love to explore and bring to life, and it's so fun to read those pieces. But what is it like to cover the Olympic Games when your own daughter is out there competing in them? Yeah? Pat Forty is a senior writer for Sports Illustrated. He's also the father of Brooke Forty, who just won a silver medal swimming on Team USA. Good morning, Pat. Congratulations, Dad. You've covered a lot of Olympics. This has got to be so different, so special. Talk about what this experience has been like for you, and can you even stay focused on the actual job?
Yeah, this is the 9th Olympics I've covered, and certainly the most memorable, the most thrilling, the most nerve-wracking, all of those things. You know, the confluence of events and circumstances here is incredible. You know, to have my daughter on the team is incredible. To be one of the very, very few parents who's able to be here because of my job is an incredible bonus, and I feel very lucky about that. So, it's been overwhelming. It's been just amazing and thrilling. And, to see the smile on her face when she's had these great swims here and in the Olympic trials, just to be on the team and then to be able to be part of a medal-winning relay is incredible.
Absolutely. And Pat, of course, you wrote a moving article about your daughter's journey to this point and merged being her father and being this writer about this moment that she became an Olympian. Tell us a little bit about this. I mean, the title right there, My Daughter's Long, Laborious Path to the Olympics. We've heard from so many athletes how this is a team effort. They say, I didn't do this alone. It was my family. It was my friends. As you mentioned, it's so amazing that you got to be there. Just tell us about what this whole experience has been like.
Well, it's kind of a lifetime in the making. And as I said in that story, also a year in the near unmaking, because it was such a difficult last year, not just with the pandemic, but also just her dealing with the pressure of trying to make this team. It's so hard to do it. So, we've watched her grow up. She's been a really gifted, talented swimmer for a long time, was able to get a scholarship to go swim at Stanford, which has been a wonderful experience. But making the team, there's, 2 people in each event, 6 people in relays. There's thousands of great swimmers in America. In her best event, the 400 individual medley, the pressure really, frankly, got to her in the last months. She wasn't able to swim to her best. She finished 6th, and we didn't think she was going to make the team, but we were okay with that because, she was giving her best effort. And then when the pressure of that event was off, she gets into the relay situation and finishes 6th and makes the team there. And that's her ticket to Tokyo. And then she swam very well here, too. So, my hat's off to her for the resilience to make it here and, the poise to be able to perform in great pressure.
Hats off to her. Absolutely. She pulled it out when it counted. You've been to many Olympics. Obviously, this is an exciting time for you to be covering things. What are some of the, besides your daughter's story, what are some of the other best stories that are emerging right now that you're seeing?
Well, I've been focused on the swimming for obvious reasons, but also I've covered every swimming Olympics for the last several. So, being here and watching Katie Ledecky's ups and downs and just her resilience through that and the emotion that she showed after winning the 1500 yesterday, the incredible rally she made in the relay last night, that's been an incredible story. Watching Caleb Dressel, which a lot of people think the most athletic swimmer we've ever seen, his explosiveness, his power, and then also his emotion on the medal stand and with his family. I've known that family for quite a while through the swimming circles, and they're a great group. And to see him, now winning 2 gold medals and probably, quite frankly, several more to come. And then some of the young kids that have stepped up and performed really well for the United States. It's been a lot of ups and downs. Yeah.
11 teenagers on that team. Wow.
Yeah. And I love hearing about the swimming circles. It's
yes.
like, you all know each other. You're all family. It's Team USA.
And it's really team because they don't have their parents there, most of them.
Yeah,
Pat Forty, thank you so much. And congratulations once again to your daughter, Brooke.
Please tell her congrats.
My pleasure. Thank you all.
Thanks. Tech titans Google and Facebook say any employees planning to return to the office must be vaccinated against COVID-19. Ride-sharing app Lyft will also require its workers to get a shot before heading back. They all made their announcements yesterday as more companies begin to take a tougher stance on vaccines. NBC News senior business reporter Ben Popkin is with us now. Ben, good morning. So walk us through the plans of each of these companies, why they announced it now, what these plans look like.
Google and Facebook said anyone coming to work at their U.S.-based campuses will need to be vaccinated. Google says it will roll this out to other regions of the world in coming months, and Facebook said it's still evaluating. Lyft also said it will require corporate employees returning to the office to upload a photo of their vaccination card, which will be tied to their entry badge to be able to get into the building. Some companies are also now pushing back their return to work dates. Most had kind of set a mid-September tied to when school starts. Google extended to mid-October, while Lyft extended all the way by 6 months to February. The Delta variant is the trigger for all of these changes. New CDC data showing that in rare cases, it can be spread by even fully vaccinated individuals and carried by them at higher rates than previously thought. That's causing everyone to do this big rethink. And the CDC now, again, of course, recommending indoor masking for vaccinated individuals in areas with low vaccination rates and rising cases.
So now how are employees reacting to these announcements that work at these companies? And also tell us, are they legally allowed to impose these vaccine mandates?
Employees are mostly applauding these changes, the ones that we've spoken to. Vaccinated employees say they're worried about infecting unvaccinated colleagues, and working parents with kids under 12 who can't be vaccinated, they're worried about bringing it back home. So, and companies are legally allowed to do so. We've spoken to legal experts. There are two exceptions, those employees who are protected under Disabilities Act and those with religious exemptions. Companies say they're going to work with those employees, likely extending work from home allowances.
And Ben, do you think we'll see more companies do this? Is this going to be a trend maybe in both the private and public sector?
Well, Biden is set to announce a requirement for all federal employees to be vaccinated. So we are seeing this in the public sector, agencies in New York City and California this week imposing mandates. But the private sector is taking a little bit more wait and see approach, watching the data. So far, only a patchwork of companies, hospitals, a meat packer here, plastics recycler there, a restaurant. But HR consultants that we've spoken to say they're hearing more and more from their clients that companies are actively considering these changes, closely watching the data in the area local to their offices as they consider their next move and watch the rising Delta variant.
All right, Ben, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.